to use medication? You obviously have to use medication in some cases, but how do they take the recommendation of dietary sort of change?
Yeah, so it's interesting. Different people will respond in different ways, that's for sure. I'm currently working within a crisis team, so I often see people in very difficult circumstances.
Mm.
And some of the people I deal with are acutely suicidal or floridly psychotic and very detached from reality. So that I have to pick my moments, and there are certain situations where it's just not appropriate to broach the subject with those people. But for the other people I see who are in a better place to listen to that sort of advice, I get mixed reactions. So some people just aren't interested at all in changing their lifestyle or their diet, and they want a quick fix in the form of a pill or ongoing appointments with a therapist, for example, and they just have no interest or motivation to change. But there are other people who are extremely interested, and certainly a cohort of people who would much rather not be on medication if they could avoid it. And unfortunately, we know in psychiatry that a lot of our medications come with significant metabolic side effects, particularly if people are to remain on them longer term. So I've had a few people recently who've started ketogenic diets to improve their mental health, and I'm following them up after they've been discharged from the crisis service. So it's been really, really interesting to see their progress, and people in slightly different situations as well. So one lady who'd had really persistent, severe depressive symptoms and agitation in the context of bipolar disorder, and she had a very quick response and improvement after adopting a ketogenic diet. And various life stressors have come along that can destabilize people, but yeah, it's been really interesting to see the progress when people are willing to make lifestyle changes.
So most of the psychiatric medications, what do they do? What are they? Are they like additional do they contain nutrients? Are they hormones?
No, they target neurotransmitters primarily. So they target chemicals such as serotonin or noradrenaline. Some of them target dopamine in the body, and you get slightly different effects. So that there are lots of groups of antidepressants, and they all have slightly different actions, but work on similar neurotransmitters. But you're really just playing around with levels of neurotransmitters in the brain when it comes to psychiatric medications. The exception being drugs like diazepam, for example. They are very effective in the short term, but highly addictive. And they work on GABA, which is the main inhibitory neurotransmitter I mentioned earlier that's responsible for relaxation.
It's fascinating. So in theory, they should make a difference, except the side effects, of course, right?
Yeah, so treatment outcomes vary from person to person. So some people do really well on medications, and then we see other people who end up trying lots and lots of different medications and don't necessarily get the optimum result that they would want. But I've certainly seen medications being helpful in people's lives. I just think there's so much more that we could be doing that we're not necessarily doing in mainstream medicine. So there can be lots of other underlying issues for people, such as problems in their gut with dysbiosis, so alterations in the proportions of gut bacteria. We don't test for any of that. We don't test for other toxicities, such as heavy metal toxicities or environmental issues. So mold can be a big issue for some people, or organophosphates, so substances that actually disrupt other neurotransmitters in the brain, such as acetylcholine. We know that organophosphates do that. So there's a whole wealth of other things out there that aren't really particularly paid attention to within mainstream psychiatry, but that would fall more into the realms of functional medicine.
Mm-hmm. Do you use any supplements in psychiatry? Do they have a place?
Standard practice, I would say, on average, no. So in days gone by, you might have seen fish oils being supplemented for some people, particularly in psychosis or schizophrenia. But as standard, no. So people don't look at sort of the B vitamins or micro deficiencies that people might have. other than a B12 and a folate, which would be the standard blood test, but they're not testing for any others. I, on the other hand, I'm quite a fan of supplements, so I do mention them to people if they want to look into certain things.